In last video, we covered healthcare business anatomy in brief. Healthcare business anatomy comprises of 6 steps. So one is awareness, acquisition, conversion, retention, revenue, and referral. If you have missed this video, please watch this video in this link given here. In today's video, I will explain all the process and methods that you can use to establish this healthcare business anatomy in your clinical practice. So stay tuned till the end. Hello, I'm Dr. Nikhil from Circadian Communications and Analytics, an agency which is specialized in growth hacking for healthcare businesses. To explain the execution of healthcare business anatomy, let's take an example of a cosmetic dermatology clinic. Cosmetic dermatology clinic is a typical clinic which offers services like acne treatments and pigmentation treatment, hair loss treatment, and multiple. The one parameter which we have to take into consideration, there is no IPD. Here, people come for a session-wise treatment. If patient is coming for an acne treatment, the patient has to come for 5 to 6 sessions to complete a treatment and give you a detailed revenue from that particular patient. Let's start establishing healthcare business anatomy for this XYZ cosmetic dermatology brand. Phase number 1, that is awareness. As if you can recall from the last video, awareness is a phase that how many people actually know about your clinical practice very well. Here, when they know your clinical practice in a positive sense, not in a negative sense. How you can create this awareness? You can exercise ATL, BTL. I won't go into ATL and BTL thing because we are exclusive in a detail. I'll cover how you can create an awareness about your cosmetic dermatology practice in a digital format. Here, our live example of a brand called Clear Skin. Clear Skin is a typical cosmetic dermatology practice. If you look at the content which they are creating, that content is completely and clearly a clinical content, solving patients' day-to-day queries about the treatments, about the diet, about home remedies and whatnot. So if you look at this, in a way, this is not any kind of a marketing gimmick. Here, you are delivering content and solving patients' problem, and ultimately it is creating that a kind of a virality cycle which is increasing awareness about your brand. This awareness is not only sake of awareness, it is creating trust in patients' mind about your brand. Why? Because you're helping them in day-to-day queries which no other clinical brand is helping them. Because all these clinical brands are into a communication when patient is coming into OPD. Here you are going to a patient, creating those videos and solving their problems. In your OPD, you do not have a time to solve each and every query, but using awareness tactics, especially the digital awareness tactics, you can literally solve all the queries. There are hundreds of videos of these people, Clear Skin brand doctors out there on internet, and people are watching for last 3 years. So by creating this trust, you're solving a biggest problem. If you can recall from the last videos, there are 3 main differences in the healthcare business and other business, right? So difference number 1, that this you cannot create a demand, which is a very plain and simple. Difference number 2, this is a loss aversion industry. Difference number 3, people has to take decision based on an incomplete information. Here you are giving them a complete information so they can take a rational decision based on your information, and this thing is creating a trust about your brand. Now you have created a very good, very clear awareness about your brand. Here, people will start contacting you and your brand in a multiple ways. In this case, this Clear Skin brand is a multiple ways. They'll go to your website, they'll read your blogs, they'll fill up this book appointment form, they'll directly call, they'll comment on your YouTube videos, message on Instagram, LinkedIn, Facebook, WhatsApp, chatbot, there are email, there are multiple ways that people will try to contact you. This is what an acquisition. But if this 5 million people are watching a video, not 5 million people are going to contact you. There are multiple reasons. Likewise, let's take an example of a website. This particular Clear Skin brand is getting 30,000 visitors per month to their website. They are reading blogs and everything. But out of those 30,000 patients, only 3,000 patients are trying to contact them. What is happening to the remaining patients? To convert those remaining patients, we'll have to implement a specific methodology called as a conversion rate optimization. So that if right now only 3,000 people are filling up a form, implementing this conversion rate optimization, 6,000, 7,000, there is no limit. People start contacting you and these leads will come into your acquisition phase. The only limit is that how great you are in implementing this conversion rate optimization methodology over here. Right, let's take an example. 3,000 people are contacting you. Out of those 3,000 people are contacting your reception or your sales team will call them and try to book and try to convert them into an OPD walk-in. But out of those 3,000, only 300 patients are coming into OPD. Right? Then there is a problem because you are losing 2,700 patients. Why you are losing your 2,700 patients? Because your sales pitch is not waterproof. Here, you will have to implement the sales pitch optimization methodology so that maximum out of those remaining 2,700 patients will come in your OPD. Now let's go a little back, right? So let's take a random numbers like 3,000 people contacted you. Out of those, only 300 people came. You optimized your sales pitch. Out of 2,700, more 700 patients came. But the remaining 2,000 patients, what you can do? Here you implement the drip campaign. You implement an indirect communication with them. How do you implement this indirect communication? Because you have a data that this particular patient is contacting you for this XYZ treatment. Let's take an acne treatment. You will send them SMS, you will send them WhatsApp messages, you will send them emails. And these emails and these WhatsApp messages will have an educational content into it to increase the trust value and to solve their problems. Once you keep on solving their problems indirectly with an information, there is a high chance and high probability that out of those remaining 2,000 patients, maximum patients will convert within 2 months, 3 months, or somehow they'll convert into your actual walk-in. Now, third phase, that is conversion. You have already converted X number of patients from your acquisition phase to your OPD. Right? Patient has walked in, he goes into your consultation room, and then here comes the third barrier for the conversion. Here comes the third thing. It doesn't matter how many patients comes to your OPD, right? If all of them are not getting converted into an IPD or your services, your business is stall over there. Here, your consultation and the counseling value matters more. Not only consultation and counseling, your in-premise experience is also important over here, right? If your receptionist is talking rudely, if your waiting area is unhygienic, if there is a long waiting period, then it increases the dissatisfaction level amongst the patient, and ultimately conversion from OPD to IPD or the conversion from OPD to service decreases. And to achieve this watertight experience, the next methodology comes into picture, that is called as a service design, on-premise service design. Everything is architectured, everything is choreographed in such a way that it will give a world-class experience to your patients, not only in OPD or the consultation experience, but also in-premise experience. Now let's take an example, like 1,000 patients came to your OPD, 1,000 patients came to this clear skins OPD. Out of them, only 100 patients opt for this acne treatment. What will happen to this 900 patients? Here we launch the drip campaign second phase level. Here also we keep on releasing was very specific and the segmental content to all these patients to increase the conversion from OPD to IPD. Not only a drip campaign, here you should have an offline campaign also. Right? Your people from your office are calling to the patients to get a feedback from a consultation, to ask them whether they are taking medicines or not, to conduct courtesy call or not. In short, you'll have to tell them, even if you are not in your premises, we are with you to solve your problem, whatever problem we have. Once the patient is converted into a first session, In this case, first acne treatment session, right? You'll have to retain that patient for 6 sessions for few reasons. Reason number 1, to deliver a good result, that patient has to take 6 sessions. And reason number 2, to achieve a maximum amount of LTV from the patient. LTV stands for a lifetime value. You have spent some amount to acquire that one patient, and if you cannot get a larger lifetime value, larger revenue from that patient, your marketing ROI is definitely going to decrease. So to retain those patients, you should have the retention process in place. Once you have retained this patient, you can maximize your revenue with upsell and cross-sell techniques. So for example, if patient is coming for an acne treatment, you can upsell for acne pigmentation treatment, you can upsell for the acne scar treatment, you can even upsell for hair loss treatment, hair transplant, any type of a relevant treatment to the patient, so that your ROI or your revenue out of one acquired patient increases. Now, till this phase everything is fine. You have a watertight experience. You have an excellent world-class experience in your clinic. Your clinical results are really great. Your retention methodologies are not poking, but people are getting a very supportive vibe from your clinic, that you are available to solve all the problems, not only clinical, but psychological, nutritional and dietary problems also, obviously in relation to your clinical ailment that you are treating. Then satisfaction level of the patient increases, and ultimately the final master tool come into a picture, the master marketing tool come into a picture, that is word of mouth. And here you can also establish a referral cycle on Google reviews and Practo reviews and Just Dial reviews and any type of a review, video testimonies. You can establish that cycle, but the most important is you will increase your word of mouth, and that is your gold mine of a revenue. Now, how do you gauge that everything is working fine? Here, the final methodology we use is business intelligence. We track each and every step, each and every activity using process mining, business intelligence and marketing intelligence, so that you will get a number and a quantitative view of your whole practice. So in today's video, you understood in detail what are the process and methods that you can implement to establish this healthcare business anatomy. To get more knowledge, stay tuned to our channel. Thank you.